Associate Judge Lynn Morset, and I'm here to talk to you a little bit today about your nursing notes. And it's going to involve four particular processes, but it really, from my standpoint, it's the entire legal process from start to finish. We have patients who come into the hospital, and sometimes we have family that will come in and testify and give us the evidence we need. Sometimes we have police officers who pick them up off the street also give us the evidence we need. But quite frankly, sometimes those police officers are otherwise occupied at the time the trial comes up, so they can't be there. And sometimes the family has been through this process with their particular family member time after time again, and maybe their boss has told them, look, if you miss work one more time, you're fired. Well, they got to put food on the table. They're not going to be able to make it in. So the next thing we look to is the doctor's testimony. But generally speaking, a doctor only sees these people for 15 minutes on a good day. You all see them 24/7. And when the doctor sees them, it's usually for an interview situation, and the patient knows that they can't hurt the doctor or hurt themselves during the process of that hearing or that interview. And so as a result, the doctor is going to rely for his diagnosis on the nursing notes you take. And now, specifically speaking, we get nursing notes all the time that say the patient is, or doctors who testify that the patient is either agitated or aggressive. And it used to be that when I first started here that I would sign an order on somebody because they were agitated or aggressive, but that's really just a symptom, okay? And I had a patient come down for trial one time, and the nursing note said that the patient was aggressive. And the patient said to me, I don't know what they're talking about. I've never been a violent person, you know. So we called the doctor in to actually testify. And the doctor said, oh yeah, the patient flipped me off. Well, that's not Tea Party behavior. It certainly is aggressive, but the standard, the legal standard that we live by is a serious risk of danger to self or others. And I sign an order, and when I sign those orders, I sign the order for 90 days. I'm holding the patient there for 90 days against their will, and it's out of my hands after that. It's up to the doctor to decide whether they can leave or not. And as a result, I'll be honest with you, I've flipped people off in my life, and it's not something that you should be held against your will for 90 days for. So as a result, now when I see vague terms like the patient was aggressive, I won't sign an order based on that. If the patient's threatening serious risk of harm to self or others, it's the same thing. If they're threatening to kill themselves, they're going to hang themselves, overdose on drugs, whatever, we can hold them. And if they're threatening others, I can hold them. Look, I'm going to beat you within an inch of your life. I'm going to kill you with this knife. Anything like that that's a serious threat of harm to self or others, I can hold the patient on. But we got one, again, had a hearing one time. Patient was allegedly threatening, and patient, again, comes down and says, I'm not a violent person, don't understand, I didn't threaten anybody. So we called the doctor over. The doctor came over from the PEC unit and said, oh yeah, the patient said that if I didn't release him immediately, he was going to sue me and sue the hospital. Okay, doctor's not lying. It is a threat, but it is not a threat of serious risk to harm himself or others. And so if all that's in the nursing notes or all that the doctor can testify is that it is a threat, I'm releasing that patient, okay? People in the United States of America have a constitutional right to be crazy and remain at large. It is only if they are a serious risk of harm to self or others, or there's a third criteria, which is basically, I call a delayed harm to self, that we can hold them. And that's where a patient is so scattered and so mentally out of it that they won't feed themselves when you put the food in front of them because they think it's poisoned, or they don't even recognize it as food, or they're catatonic. Eventually, they're not going to kill themselves that day, they're not suicidal, but eventually they're going to degrade, they're going to die, and if we didn't have some standard to commit those patients and get them medicated, they would die without us doing anything. And this sets forth in four specific examples. There's the magistrate's warrant. Well, guess what? Sometimes the magistrate's warrant is done off what the family does, and that's fine when that's available. But again, if the patient was brought straight off the street for some reason or came from the jail, there may not be any information to give in that magistrate's warrant. Again, what we're undoubtedly going to look is to the nurse's notes, and they're going to look to that to fill out the warrant, and the magistrate that looks at it is going to see what behavior did you observe. There is a hearing after has to be within 48 hours unless it's over a weekend, then it has to be by 4 o'clock on Monday, and it's called the probable cause hearing. Again, we look to the information that we've got that goes in. There's no trial, there's nobody comes in and testifies. At most, it's just the witness or the proposed patient themselves. But then what we'll do is we'll go back and look at the records. What's in the records? What has that patient done since they arrived at the hospital that we can hold them on? So if you got a clear, the patient cocked back his fist, threatened to punch my lights out, there's a threat of serious risk to harm herself or others I can hold somebody on. If it just says patient threatened me, you might as well not have written a note. It's worthless. It can't be, I can't use it. I'm not going to use it. The next step is for application for detention. That's where they decide they want to go to the next step and possibly hold the patient for 90 days. Again, they've got to have good evidence to base that on. Again, you're going to be the majority of the evidence that probably gets used. And finally, there's the commitment hearing. And in our case, we have commitment hearings by 2 different processes. First, the patient comes down and we go through a full trial. Witnesses are called, they testify under oath. But again, I would say probably the vast majority of the cases, I don't have any witnesses except for the doctor. The doctor didn't witness any of the information that he is testifying to. He's just taking it straight from the nursing notes. So again, if he's got good detailed notes, they'll get into it, and the defense attorneys will ask questions to clarify and make sure that